Good morning all. My name is Ishita and today our topic in the cardio PT in cardio is PNF techniques for contraction of abdominal muscles and vertebral flexion. Now, what is the PNF technique of co-contraction of abdominal muscle? Like in definition, we can say that co-contraction refers to the stimulation activity of agonist and antagonist muscles around the joint or the trunk, resulting in stability rather than in movement. Now, the goal in PNF of co-contraction is to develop core stability, postural control, trunk coordination, especially in the conditions like stroke, traumatic brain injury, spinal cord injuries. Now, PNF techniques. First one is the rhythmic stabilization, that is altering isometric contraction against resistance applied in different directions. Applied to the trunk, pelvis and the shoulder to encourage co-contraction of deep core muscles. Example, transverse abdominis, multifidus obliquus. Example, patient is sitting or in on quadruped. Therapist applies a gentle manual resistance alternatively to shoulder and pelvis. Patient maintains positions like don't let me move. Now second is stabilizing reversal. Isometric resistance applied in one direction then gradually change to the opposite side. Anthemic dynamic trunk control and muscle recruitment. Now what is vertebral pressure? That is spinal stability or axial control. Now the purpose of the vertebral pressure is to improve vertebral alignment, posture awareness, control spinal segments, and it is useful in managing postural stability, hypertonia or hypotonic, poor if the patient is having poor trunk control. Now PNF application, that is approximation, gentle compression to the spine during sitting or quadruped position, stimulate postural extension and promote right posture. Developmental positions like quadruped, bridging, sitting, kneeling. These are used to apply controlled pressure through the spine to activate co-contraction of stability. Now there is a specific technique in which if the patient is having quadruped, we can apply approximation plus rhythmic stabilization. Therapists apply downward pressure to the shoulder and pelvis, alternative resistance to encourage spinal segment co-contraction. Now, clinical application of the PNF technique like stroke rehab for the patient having no trunk control on the affected side, Parkinson's like postural correction, spinal cord injuries for activation, lower back pain for lumbar stabilization. Now, summary table in which we can say PNF technique, rhythmic stabilization. The purpose is trunk co-contraction and stability, muscle activation, that is abdominal and paraspinal, stabilizing reversion, in which the purpose is postural control and balance, abdominal muscles which activate the abdominals and obliques. Approximation technique, the purpose is facilitate axial extension and posture, and the muscle that activates the paraspinal and multifidus. Thank you.